Happy Saturday morning, everybody. It feels like I just saw you because I just saw you on Thursday night. So we're having a number of conversations this week because a lot is happening in our district and at the federal policymaking level. I am so pleased to have two friends of mine and who are institutions in this field, Anthony Wright, Executive Director of Families USA, and Elisabeth Benjamin, VP of Health Initiatives at the Community Service Society of New York, with us today to talk about the One Big Beautiful Bill and different names for it, and also what it's most importantly what it's going to do to Americans and to New Yorkers. Thank you all for tuning in. As a reminder, know your messenger. For those who are kind of viewing for the first time, it's really nice to meet you. I'm Kevin McAvey, husband, father of three, Bedford resident, lifelong New Yorker, state health policy consultant, and an advocate for good government. And this is my shameless opportunity every week to share pictures of my kids. The purpose of these forums, and I think we're now at around 8 videos, 8 like full interviews of some kind or another, clips that we've been putting online since February, which have resulted in total of nearly 170,000 views, which is remarkable because prior to February, I didn't know and had never posted a video on social media. And I still don't really know what I'm doing, but I appreciate your patience and your engagement and appreciation of just talking about public policy and the facts of the matter and making sure that your thoughts are well represented. Know that advocacy does matter. And we've even seen Representative Lawler's positions from phone calls that you place, from letters that you write, from your showing up in these events every single weekend. It does make a difference. And so the purpose of these forums is to engage residents of NY17 in the political process, equipping our community with information about the policy issues impacting our families, households, and businesses to help us identify the best person to represent our interests in Washington, D.C. in 2026. While I think we have three parts of our mission to discuss the issues, to foster community, and to introduce the candidates, I think we've done a good job on the third one over the past few weeks. I think you've met at least 6 of the 8 candidates so far running for at least the Democratic primary in NY17. Representative Lawler is always welcome to come on and join us and answer questions. Today, we're going to be focusing on the facts, discussing the issues, and hopefully fostering community. With that, I am so pleased to be able to introduce Anthony Wright. Anthony Wright is Family USA's executive director. Before joining the organization, he served for 22 years as the executive director of Health Access California, the statewide healthcare consumer advocacy coalition. Under Wright's leadership, Health Access California led state efforts to win patient protections, fight budget cuts, invest in the safety net, expand coverage, and advance equity and prevention. He's a consumer advocate, a community organizer, quoted widely in state and national media. His background also includes working for New Jersey Citizen Action, the Center for Media Education, The Nation magazine, the White House and the VP's office, and really relevantly to today's conversation, he was born in the Bronx, so he knows New York pretty well. It's really wonderful to welcome Anthony. Thank you so much for joining us.
Thank you for having me.
How are things going?
In DC, things are tough. The bill that I know you have been focused on, the big bad budget betrayal of a bill, is moving along, and it's coming to a head. The Senate is likely going to try to jam this bill through the Senate this week, and so that's why if there's any advocacy to do, this is the week to do it. This is empty out the barrel time. This is because their plan is that if they move this bill through the Senate and get it through all the Senate machinations by midweek and by the end of the week, they go on a recess because next week is July 4th week, but they may actually stay in session for another couple of days, not just to get it through the Senate, but also to jam the House. And so this is when representatives who maybe express concern about this provision or that provision this is where the rubber will hit the road,
Yeah.
and they will be have to vote one last time before this becomes law.
And is this all just because they don't want people to understand what's in the bill and then like learn that this is not necessarily going to play out in their favor?
That's right. That in the House bill, they basically took exactly 10 days before when they released the text, and when they spent did overnight sessions with sessions at 1 a.m. to get it through in a very short time, 10 days. And in the Senate side, where apparently it has gotten worse, and I'm happy to talk about the substance of it, they look like they're going to work on a very similar timetable, where basically they just introduced it earlier this week on Monday. Happy to talk about what's in that text, and then they're going to try to pass it all done by next week, because they know the more that it's out there, the more unpopular it gets. It's right now significantly underwater, and so they're just trying to jam it through without people realizing what's in it.
Yeah, and so I want to talk about what's in the bill, and I think that folks thought that the Senate, maybe like 2 weeks ago, like the perception was the Senate might moderate what was in the House, but I think it went very much in the other direction. But I want to kind of talk about your journey for a second, because I think that there are important, and I assume that there are important lessons learned. You've been advocating for change for the betterment of consumers and patients across, like in California and now across the country, for decades. Like what lessons have you learned that you're keeping in mind now that are going to be really important to make sure that we get to hopefully a better outcome?
I do believe I've been a community organizer for 3 decades at the state level. I am, as you said, a proud son of New York and of the Bronx, and have spent a lot of time in Westchester and Hudson counties. But my experience at the state level is that healthcare matters. There's rare an issue that directly impacts people so deeply, to themselves and their family. It's literally about our health and our livelihood, whether we can have access to the care that we need. And it's an issue that breaks through across the board. So there's a reason why a number of elections have pivoted on the question of healthcare. There's a reason why when people change healthcare for the better or for the worse, it matters to people, and it breaks across party lines almost. So I do think that advocating around healthcare matters, and that and so I hope that folks feel like, of all the issues to work on, why this one at this moment? And I think it's because it's one that actually can break through to a broader set of folks that may be low information, that may be focused on other things, but they will notice if they lose their health coverage. They will notice if the local hospital has to scale back services as a result of this bill.
Yeah, absolutely. And not only does the bill impact us all, but I think everyone, and I've been noticing this as I've been going across the district, talking to different committees and groups, like healthcare is a concern for everyone. I think it's a rare person that you'll ask, like, how do you feel about like your health care right now? For what are you getting what you're paying for? And I don't think you'll see many people that are like, yes, I am, or very happy. And yet this bill doesn't focus on actually solving some of the bigger issues, making sure that folks in America have access to affordable, quality healthcare. In fact, it actually focuses on making it harder for people to get some of our most vulnerable, lowest income Americans to get access to healthcare. And has this weird proposition that you have to earn your health care. You have to work to get health care, as opposed to kind of the reality that many of us know. Like, if you're healthy, you are more likely to be able to work. And so with that, would you mind kind of talking about like what's in the bill and what did the Senate do to it?
Yes, and some of this is on our website at familiesusa.org, and has a whole page of resources, familiesusa.org/defending-Medicaid, including a specific fact sheet for New York 17th District, as well as districts around the country, and a specific summary and full analysis of the Senate bill as was proposed just this Monday. But I really think that this is an attack on healthcare coverage, on healthcare costs, on healthcare, and on specific communities. On coverage, the result of the bill is that, according to the Nonpartisan Congressional Budget Office, is that 16 million Americans will lose coverage as a result of the policies in and not in this bill. And fundamentally, it's people losing coverage through complexity and confusion. People will be either pushed or priced out of coverage for both public and private plans. So that means that in Medicaid, folks will have to reapply not once, but twice a year, even if nothing has changed with their status. People will have to document the work that they do, but on a very regular basis, and the paperwork themselves will force millions of people off of coverage, estimated over 5 million people, not because they're not working, but because of it's hard to document if you're a seasonal worker, if you're a gig worker, if you're an independent contractor, if you're a range of categories, if you're between jobs and looking for jobs, if you're a new internet entrepreneur, those are not things that you get a standard form for that you could easily submit to the government. And even in those cases, that's a burden that will mean people fall off of coverage. There's a range of other things like that will discourage coverage. On the private insurance side, while this is extending tax breaks for the wealthy and big corporations, it is not extending the tax credit that people have gotten over the last couple of years that have meant 4 or 5 million more people getting coverage. That will come. So that will come down by 4 or 5 million people. People will see their premiums spike by on average $700, but for many people, especially in high-cost areas like New York, thousands and thousands of dollars. It also makes it harder to get on because we'll get rid of pre-verification and other things to make it easy to re-sign up and get that affordability assistance. So again, more people falling off of coverage, which then leads the rest of us to be in a smaller and sicker risk pool, which means premiums go up even further. So that goes to my second point, which is costs.
Yeah.
That there are specific costs in this bill, specifically to raise co-pays in Medicaid for those just over the poverty line. There's specific things in the private side, in the marketplaces, that raise fees and charges as well. And as I mentioned, things that will raise the cost. When we just had an election about affordability, the most direct impact of that of those policy changes will be people paying hundreds, if not thousands of dollars more for health coverage. And then finally, the attack on our healthcare in general, that these are cuts that fundamentally attack the way that states finance their Medicaid program. And that means less money for the program as a whole. So it doesn't matter. So yes, there's specific attacks on specific populations, but it doesn't matter. It's cuts to what New York gets to fund its Medicaid program, which means that then New York is placed in the tough situation of, do they just cut payments to providers, cuts to hospitals and clinics and nursing homes? Do they cut benefits like dental and vision? Do they cut home and community-based services? So this is a major, just a massive cut, actually the biggest cut in the history of the country to the Medicaid program and to healthcare in general. And then just for cruelty's sake, there are specific cuts to specific communities, including LGBTQ folks, women and their reproductive health, immigrants, including penalties to states that provide any service to immigrant kids or even legally present immigrants. And again, those seem like those are cuts on specific populations, and as bad as that is, it actually ends up being a cut again on the healthcare system that every New Yorker depends on. So that's why. So that's the broad outline of this. And then in a couple of key ways, in the cuts to provider rates, which is one of the main ways that states finance the Medicaid program, they made that significantly worse. They expanded the paperwork requirements to a broader set of folks that include parents of teenagers. They did a range of other things to make this, and we've heard rumors that they're actually going to go further in making this actually worse than the House version. And that's what we're fighting against right now.
And it is so astounding to see some of these statements come out by representatives, including one of our leading representatives in New York, who just made it seem as though getting Medicaid was easy, like it's an honor-based system, and kind of having to renew your Medicaid on twice as often and submit new paperwork for work reporting requirements was not going to be a hassle, and is not going to result, as we've seen in practice in Arkansas, in Georgia, and elsewhere. Like, it's not purposefully going to make it harder for low-income individuals to get health insurance, and ultimately knock many people off of healthcare. But someone who's been setting the record straight in New York, as you have in California and across the country, is Elisabeth Benjamin. And I'm so happy to have her here to join the conversation. Elisabeth is an institution in New York, and was one of my first rally partners and cheerleaders. And I was so happy to have her there and her encouragement. She's Vice President of Health Initiatives at Community Service Society of New York, where she supervises health policy, health advocacy, and consumer health assistance programs, including the CSS Navigator Network, Community Health Advocates, or Independent Consumer Advocacy Network, Harlem Health Advocates Project, and the Small Business Assistance Program. Collectively, these programs help over 100,000 New Yorkers each year enroll in or use their health insurance or access low-income health care. She's a co-founder of Healthcare for All New York campaign, and a statewide coalition of over 170 organizations devoted to securing affordable, quality healthcare for all New Yorkers. She's published everywhere, is a frequent commenter about health policy issues, and is here. It's nice to see you. I'm going to unmute you.
Everyone who's listening.
Yeah, of course. So, Elisabeth, for folks who don't know, just to start, like, what does Community Service Society of New York do? And when did you join?
I joined 18 years ago. Before that, I worked at the New York Civil Liberties Union and the Legal Aid Society and South Bronx Legal Services. So like Anthony, I have a strong Bronx connection. And I like the Yankees. I'm just saying. But I like the Knicks better. And I really love the Liberty. So
there you go.
We're the only champions. Just
close this year.
Yeah. So anyway, I started there 18 years ago. And the Community Service Society is an organization that's been around for over 180 years. We have worked to improve the lives of working and low-income New Yorkers during that whole time. We founded the Hospital for Special Surgery, Columbia School of Social Work. We started a pilot project for child health clinics, and lots of exciting policy initiatives. What I do is I supervise the healthcare department that has a very large direct service operation in partnership with community-based organizations all over the state of New York, including several in New York 17, Westchester Disabled on the Move, and in Rockland Community Outreach Center. So the really great organizations. And if you want health insurance, one of the things we do is we're the largest Obamacare or health insurance enrollment organization in the state. We enroll over 60,000 New Yorkers in Medicaid, Affordable Care Act, Essential Plan, Emergency Medicaid. You need healthcare, we can get it for you. And then if you have problems after enrollment, or if you just have a job-based coverage, and you will see on your notices from your insurance company, if you have problems with your health insurance, you can call us and we can help you kind of fight it out with your health insurance company, or get your hospital to reprocess the claim correctly more often than not, and things like that. So we're here to help New Yorkers, and we do it every single day, and it's our great privilege to do so.
So I hate calling it the one big beautiful bill. Like, this bill is going to have a disproportionate impact on New York. Yes. And I think that is consistently lost in the conversation, and is very befuddling why any of our representatives are supporting it, especially in its present form. To understand why it has a disproportionate impact on New York, you have to understand New York's healthcare system, something you've been helping us to kind of form and shape for a while now. Could you talk to us a little bit about Medicaid, the Essential Plan, and the marketplace and like how this is actually going to impact New York differently than other states?
Yeah, sure. How much time do you have? Anyway, so let's start from the big number. The big number is 16,000 people will lose coverage under this bill, right? Or maybe it's more now after the Senate's done whatever they've done.
And that's in the district? Yes.
And in the district.
In the district,
Well,
New York City.
let's just break it down. 16 million around the country, right?
Yes, okay, there we go.
16 million around the country. Did I say 1,000? I meant million. Sorry. 16 million people around the country are going to lose coverage.
Yep.
Of that, 10% hits New York. So that means 1.5, 1.7 million people in New York are going to lose coverage. And then of that, in Congressmember Lawler's district, we think it's around 30,000 people. So 30,000 of your friends and neighbors are no longer going to have health care thanks to this bill. And that's a problem for people like me and for people that care about, our community. We really want people to have health coverage, and it's really important. And I think there's this real disconnect between is, healthcare something that you shouldn't really have easy access to, or you should. And I actually think you should. I think we want people to have healthcare because everybody's healthier. The other thing that I think is lost in this is that some researchers at Yale and University of Pennsylvania did this really important study that shows that basically 42,000 people are going to die every year for not having coverage. If you cut people off coverage, we have sicker people and more dead people.
Yes.
And so think about that. Of that, again, 10% of this hit disproportionately of the country, 10% hits New York. So that means that 4,200 of our friends and neighbors are going to die unnecessarily in New York because of this bill. And that's just an outrage, I think, pure and simple.
Yeah. And if people think that that's extreme, I'll just ask everyone to take a moment and really think about in your life those individuals who might not have a lot and who might hesitate at being willing to go to the doctor just because they might be underinsured. Now imagine you don't have health insurance. How does that calculus about whether you get medical attention for conditions that you face, get prescriptions fulfilled, change? It like not having access to affordable quality healthcare is a life and death proposition for many people in our community.
And we just did a survey on that note in February, a big statewide survey, and we found that 66% of New Yorkers are having either skipping visits to doctors or cutting their pills or delaying going to care because they're so worried about the current costs of our healthcare system. And and that's up from 2019. So we have an affordability crisis in New York, and having 10% of our 10% of this impact of this bill, this giant bullseye on New York, lose coverage is just going to make all of that worse. We already have hospitals. 53 hospitals have closed since the 90s, right? We've already lost hospitals. More will close. Health insurance premiums are slated to go up by 38% or $2,700 more per year. So while our members of Congress seem, determined to work on increasing the tax deduction for middle income and wealthy New Yorkers, they're doing nothing for the rest of us.
Yes, absolutely. And Anthony, I think this goes back to your point where, and Elisabeth, what was the New York figure again? 1.5, 1.6?
1.5 million is what I've seen, but
me too.
You said 1.7. So
I've heard up to 1.5 based upon estimates. And I actually think those estimates have been confirmed by some of our GOP colleagues in a letter they sent out, which I'm calling like the oopsie letter. They sent to Speaker Johnson a week or so ago. But like Anthony, like this is going to your point that this is the direct impact on individuals, but it's like kind of a bomb going off in a community. It has many layers of people who are going to be impacted because when you kind of lose dollars for healthcare, your healthcare facilities, your hospitals are going to have to make really hard decisions about access or if the market allows, seeing if they raise costs. Is that right?
Yeah, no, I think that so your local hospital, even if you're not on Medicaid, your local hospital, your local clinic, your nursing home, your maternity ward, in many cases, Medicaid is their number one payer. That's true for maternity wards. That's true for nursing homes. That's true for rural hospitals, and for many hospitals, it's your number one payer. And so first of all, there are direct cuts to provider payments the state has to do when they get less money. And one of the big things in this bill that got worse in the Senate bill, but was already bad in the House bill, was a cutting of that basic undercutting of financing of the healthcare system through called provider taxes or state-directed payments or things like that. No, that's so that's a direct. So those will be direct cuts to providers. But then the other cut is the loss of coverage. And if you have more uninsured, that means that not only are those individuals living sicker, dying younger, and one emergency away from financial ruin, but that also means that for the healthcare providers in that community, that means less paying patients and more uncompensated care. Because it's not like people then disappear from the healthcare system. They're in the healthcare system, but just not getting primary preventative care. They're only getting care in the most expensive, least efficient way possible, which is on the back end in the emergency room and in other ways. So it's a double whammy of both a direct cut to these institutions and then a fundamental cut to their business model. And so when some of the senators are thinking, well, maybe this bill will be okay if we do like a rural hospital stabilization fund or some other Band-Aid approach. First of all, those rural hospitals or maternity wards or other things that have been facing tough times, as Elisabeth said, people have been, those institutions have been on tough times already. Maybe they need some help, but that's already now. That's in a situation where you're cutting over $800 billion, the biggest cut out of the Medicaid system, then that is a catastrophe. And that's basically and so a kludge like that is basically putting a Band-Aid on an amputated limb. It doesn't.
And I just did some quick math on that one, Anthony. So say in 2019, 2018, Urban Institute said for every person uninsured in New York, it costs about $1,700 a year in uncompensated care. You times 1,700 times 1.5 million, that's $2.5 billion more in uncompensated care costs our hospitals are going to have to incur. And guess what? That means all of us are going to be paying more in health insurance. And all of us are going to have to wait a hell of a lot longer in the emergency room. And all of us are going to have to wait a lot longer for all of our services. Sorry, Anthony, I think I interrupted you, but it's, I just want to bring it down to New York. This is a problem for us. And it's not okay that we disproportionately own the hit that this bill has. And the fact that we have 7 members of Congress, well, 6 plus 1 who slept for the vote, but we literally have 7 members of Congress that are essentially voting for this huge, could you make it worse for New York? It's hard to think how.
Absolutely. And I do want to call out, and I put in the chat, Senator Markey released a letter last week that summarized, I think it was last week, that summarized the potential rural hospital closures and the impact of this bill. 11 of them are in New York. So for any of our representatives considering running for governor, I think that this is a really important bill to be aware of and how this could actually impact access for many of our residents across the state. But Elisabeth, I wanted to kind of hang on your point. I'm going to, Anthony, I'm going to move you from the stage for 1 second. And just so I could put this up on the stage. I'm still learning here, guys. Oh, there we go. Okay, so this is the New York delegation oops letter. I know it's really small, and so I'm going to zoom in right here. This is where the Mike Lawler and I think most of the other Republicans have signed some version of this letter in New York that says, well, maybe we didn't quite understand what we voted on. And oops, we lawfully present is a really critical definition here. And individuals will be forced from one plan to another, and this could cost New York State billions of dollars. And so, given your unique perspective on this matter, like, what are your thoughts?
Okay, well, it's ironic. I mean, it's extremely ironic that letter cites a lawsuit that was my client, Mr. Alyssa, and it went up to the Court of Appeals, and our court, our highest court, said unanimously that New York State has an obligation to provide Medicaid to people who are legally working and living here. So people who have green cards,
Mhm.
what the one big beautiful bill is basically saying, if you have a green card, even though you have a green card, you have to wait 5 years
Yeah.
before getting health coverage.
Mhm.
And that's what the Affordable Care Act kind of fixed. But before that, in 2001, there was my lawsuit where we were like, wait, we have this constitutional provision that says there's a duty to care for the needy. And on top of that, you know, cutting health care for legal immigrants and who are state residents is also illegal under the state and federal equal protection clause. And the Court of Appeals, our high court, agreed with us. So ironically, as right now, we are getting federal funding to, which was fixed in that was all fixed in the Affordable Care Act. The Affordable Care Act said, okay, you're here legally, you're working, you're paying taxes, you have a green card, you can have coverage. And if you're a refugee or an asylee or an applicant for those statuses, you can have coverage just like everybody, equal to everybody else, not special coverage, just equal coverage as a citizen. So that's been really great for New York. And as a result, we were able to develop a thing called the Essential Plan. And the financing for that Essential Plan came through the federal funding source that was cited in that letter. The thing that's really important to know is that everybody has really benefited by having the Essential Plan because it has zero deductible, zero premiums, and it's people are eligible for it up to 250% of poverty. So it's really a great deal for citizens as well as the small subset section of those folks who are legal permanent residents, the green card holders, the refugees, whatnot. So and the people who are lawfully present. So what the one big beautiful bill, and including, by the way, people, the young adults, the deferred action for childhood arrival folks also get that. This bill cruelly says no coverage for these DACA young adults, the people who are brought here as undocumented immigrant children, you know, and it's also going to cut their eligibility. So that, again, disproportionately impacts New York. As a result of getting rid of Affordable Care Act eligibility for lawfully present people, we still have my lawsuit, the Mr. Lippa's lawsuit.
Yes.
And so our Medicaid program and our Medicaid costs will go up because all of those folks are now going to be enrolled into New York State Medicaid. And so that costs the state over $2.7 billion a year. So ironically, they wanted to cut the Medicaid program, but they're increasing the Medicaid program. So it's a big, like blow it up in your face. It reminds me of little kids playing with firecrackers. And, I feel like our members of Congress who voted for this bill or the one person who slept for it, was just playing with firecrackers at the age of 10. I had a friend that blew out his eye playing for firecrackers at the age of 10. Like, it's not a good plan and it hurts our state. And you are doing a disservice to our state by voting for this bill.
So I am assuming that if you were advising any of our representatives in New York State, that you would say, this is your opportunity to have a John McCain moment and say, listen, I understand the party line, but this is going to hurt my state, and this is something I'm not willing to vote for. Is that right?
You would think.
Anthony?
I mean, let's even break it down. This bill directly targets New York, period. Right there. This is the equivalent of the New York Daily News headline, if you can afford to New York, drop dead. This bill is, Trump to New York, drop dead. And the question is, regardless of what you think of specific policies, do you, as a New York representative, do you vote for a bill that directly disadvantages New York, that directly disadvantages states that did the Medicaid expansion, of which New York is one of the most forward to it? Do you directly attack states that provide any help to even legally present immigrants and kids, and then actually reduce their funding formula as a result, of which there's about 10 states, of which New York is one of them? Do you vote for a bill that, again, directly targets New York in that way? Do you directly do a bill that totally messes with an only in New York mechanism like the Essential Health Plan that then screws up the financing for it by the tune of billions of dollars? Do you vote for that? Do you vote for an anti-New York bill? And you could be Democratic, you could be Republican, but I remember when representatives and senators were just really protective of their state and the financing of their state, and it really didn't. And it's just it's a nonpartisan thing. It's just a bacon thing. Bring home the bacon thing.
Compare Josh Hawley, a profile in courage, versus, you name it. I guess we're talking in Mike Lawler's district. Mike Lawler, not a profile in courage, like stand up. This is your moment.
Right.
You want to be governor. Like let's protect our state here. Sorry.
So I think that this is that the New Yorkers, the New Yorkers and New Jerseyans and Californians had particular reason to say no. I think that there's other reasons why other representatives and senators have reasons to oppose this as well. But frankly, this is an anti-New York bill, and the changes that the Senate have made it actually worse. So this should actually be an easy call for the New York representatives, because again, there's not a lot of states that do more with provider taxes than New York, and this doubles down on those cuts. There's not a lot of like that. This should be an easy call that if this goes back to the House in any version of this world, that it should be an easy no, because it's even worse than what they voted for.
Yes. It's so important for folks to understand and hear that, and hopefully as our representatives hear this, internalize it and actually represent the interests of our state and those they serve. I have a last question about like what should people do, but I do want to just underline a point that you both made about this bill disproportionately impacting New York, and I would also say California. You mentioned New Jersey, Massachusetts. These are also states, ironically, that are net creditors to the federal government, that provide more, and we give more to the federal government than we get back every year. And yet our representatives are willing to get back even less to support our local economy, workforce, and residents and their health. So as we're thinking, Elisabeth and then Anthony, as we're thinking about like what should people do, because people are increasingly, despite the best efforts of our Republican Congress right now, with moving this bill as fast along as they are trying to, having votes in the dead of night, people are starting to catch on, but they don't quite know what to do next. What should they do?
So we have a really easy thing for you to do. And for those of you who've made calls and sent letters and gone to protests, first of all, thank you. Keep doing that. But if you are like kind of nervous and never done it before, we have a little page on our website. It's the Community Service Society of New York. It says Protect Health Coverage. All you have to do is press a button, and they will dial the number for you, and you will get directly to all 7 members of Congress offices, and you can tell them how you feel. Please don't vote for this bill. And then it just rolls you over to the next member and rolls you over to the next member. It is so easy. You don't have to do it's literally one click of the button, and then you're talking to them. I've had many people answer the phone. Sometimes in other offices, you're just leaving a message, but it will take 5, maybe 10 minutes tops, depending how long your message is, or maybe if you get someone on the phone, it'll take no time at all. Please do it next week. This is the time. As Anthony has said, there's no time more important than this week. Please, please. So easy. Protect Health Coverage, Community Service Society of New York. And it really makes a difference.
And I dropped it for folks who are viewing on the recording. It should be in the comments beneath this video. So please click it. This is the week. Anthony, what should people do?
So I do think that the calls matter, that the calls, the letters, the emails, and the protests matter. And again, the Senate, you have 2 senators that are very much against this bill in New York. But if you're in a House district, this week matters to you as well, because we very well could see a House vote in those days leading up to July 4th. The more likely scenario is that the Senate does pass a version of this, and then they use July to debate the differences between the House and the Senate, and so that's a possibility for continued action, especially in targeted House districts, of which New York has several. And so I think that that's a timing thing as well, about whether it's meeting a continued meetings with district offices or calls or others. One tactic that I wanted to spotlight for for this week is actually a protest fast that I will be starting with others on Monday. Because let's also be clear that this bill has a lot of other provisions that are also bad, including some grievous cuts to food assistance and to a number of us are going to fast in 24-hour shifts, and I'll be in that first shift on Monday and then pass it on to others. And we hope that it goes viral in this hashtag empty plates protest challenge that we will. But the idea is to be in solidarity with the 7 million people who will go hungry and the 16 million people who will lose their health coverage, and to really highlight the moral urgency of opposing this bill until Congress goes into July 4th recess, whenever that is this weekend. So that's another way where people can do it, and then to get it out. And the reason why it's not the fast by itself, it's the way to sort of communicate the urgency to your friends, to your neighbors in the district that, hey, this is not another normal Senate or House vote. This is one that is a generational change in our health system and in the basic infrastructure of what we ask from one another. And so I hope that folks participate, and then they use their social media to take a picture of an empty plate and get it out to their networks, that they try to just, again, talk to their friends and neighbors, because at the end of the day, there's a lot of people who are going along their own lives, not realizing that this debate is happening and how impactful this debate will be for them. And I think that anything we can do to educate a broader set of folks is the impact that will actually get to our representatives and our senators, and create the moment, create the surround sound for potentially the McCain moment that we were talking about.
I'm going to put that in the chat as well as soon as I can get it here. Thank you so protestfast.org. If you want to, I would also encourage everyone to follow Anthony Wright and Families USA and Elisabeth and CSS on Instagram and other platforms. Elisabeth, what's the Healthcare New York tag, if you remember? Oh, you're on mute.
Sorry, community services. You want me to put that link, the Protect Health Coverage CSS in?
Yeah.
Okay, I'm on it.
Okay. And I want to just thank both of you for taking time out of your Saturday mornings. I described it in a live stream on Thursday as kind of Saturday morning cartoons for policy nerds and also for people who care. These seem like debates that are far away in Washington, but they very much are about like what we value as Americans and how we want to see our country work. I appreciate you guys bringing the facts to the conversation, giving some advice to our representatives who are debating like how they want to be remembered, and taking the time. Thank you both for joining.
Thank you, Kevin.
Okay.
Bye. So I want to thank everyone for joining this morning at 10 a.m. It's been a real pleasure. I'm not going to bring up our normal candidate slides to talk about who we're interviewing next, because I do want to keep this as nonpartisan as possible, because this is an issue where people just need to understand the facts of what's in this bill and how it will impact all of America and how it's going to have a disproportionate impact on New York. I hope our representatives do the right thing, really consider the consequences on New York and New Yorkers, and ultimately casting their final votes. As always, it's really wonderful to talk to you. Thank you for all of the wonderful notes and response and comments and views and shares and likes and loves. I don't even know, like lots of things on the different platforms. It's great to see you, and I'll talk to you again soon.